start by congratulating Honorable Minister, Mission Director for organizing such an open and professional meeting where the government is openly telling us what they are thinking, what they are doing, what they are not able to do, and inviting the private sector to participate in that journey to deliver good health care to all the people. We are also citizens of this country, so we feel equally responsible as professionals to do something good for our own people. So thank you very much for organizing something so professional and so open. I'm delighted to be here. I just thought I'll point out 3 or 4 ways in which large-scale interventions can be done using mobile and electronic technologies. Go beyond what has already been discussed, and some of which Manipal is already deeply involved in. I think the first case is how do you deliver healthcare to the patient? And for that we have heard many examples in the morning. And clearly using SMSs, phones, data is a big way to do it. A small experiment is being done in the state of Kerala, where the government of Kerala has decided to create women entrepreneurs. And these women entrepreneurs are tasked with running small clinics. But since they don't have the expertise, there is some equipment which is supported at the back end by Manipal Hospital in Bangalore, where our doctors can give consultations to these women entrepreneurs who charge a fee from the patient. And the patient pays, the woman entrepreneur makes money, a small amount of that goes to the technology provider, and a small amount of that goes to the doctor. So it works very well for everybody. I think that's one simple example which can be scaled across the country very quickly. The second thing which has been talked about since morning, but I do want to highlight it, is how do you empower the frontline worker? There are ASHA workers, there are 6 lakh ASHA workers in the country, but the total training that is given to them is around 14 days. And after that they are in the field, isolated, and they don't have a way to upgrade their knowledge or call somebody when they are in trouble. Suppose there is a child who is dying of a convulsion, what are they supposed to do? They are not trained to do that. So there is a lot of possibility to enhance the capability of the ASHA worker using devices like the Slate that was started today. That's also a very impressive initiative. But the more we do to empower the individual who is at the front line, the more effective that person becomes and the better your health system becomes. So I think we all can think of at least 10 different solutions for this. And the one key element of this is who is supporting it from the back end. Who is giving the curriculum, who is delivering the training, who is giving the update. And I'll come to that in a minute. The third way to do this, and which has actually not been talked about at all, is groups. How do you build groups? How do you put 5 ASHA workers together along with 1 nurse so that they can talk to each other? And today we have WhatsApp, we have Facebook, we have SMS group formation. Not everything has to be taught from here or from a hospital. They're very intelligent people. They can also help each other, train each other, support each other. Suppose there's somebody missing in one village, another person can go. So, but what they cannot do is create these groups for themselves. So I think there is a third dimension of how do you support group formation and use technology and encourage them to learn from each other and therefore become better and better in delivering healthcare. And the last part, which is very exciting and which is now possible, is how do you create a record, a personal health record for the whole state. Imagine that situation where 7 crore people, 70 million people have their own personal health record which tracks their vaccinations, their primary healthcare visits, their drug utilizations, the complications that they have had. And there are providers that are available. In fact, one of my colleagues, Mr. Ram, who runs a company called Praxify, is doing that for us at a hospital level. But I think Praxify is very happy to do that at a state level as well, in collaboration with the government, to say that, look, we already have Aadhaar card. Aadhaar card has been rolled out. Why can't we build a full personal health record over and above the Aadhaar card? So not only the doctor, but the administrator, the private provider, the patient, everybody can look at that record and then use that to improve the healthcare. I believe that this last innovation will have the same impact as vaccination or sanitation or improved water supply, because it allows hundreds of other professionals to use that as a platform and deliver better care. These four examples are from a theoretical basis, but then what can Manipal do in all of this, right? Manipal is most famous around the world for its passion in medical education. We have converted a small town in coastal Karnataka into a global center for education. Wherever the government needs help in capability building, whether it is at an individual ASHA worker level through technology, whether it is at a group level, we are there to support you. And we will be delighted to create a system by which this is almost automated. A lot of these things can be automated, and that's the power of technology, that not everything has to be done by thousands and thousands of doctors sitting there and working with the ASHA workers or with the community workers. Finally, we have a hospital here in the state. We are delighted with our presence. In fact, when we wanted to move to the north before going to Delhi, we came to Jaipur. So I think it tells you something about our commitment to the state. We have a large university in the state, and we are continuously working closely with the government. We have mentioned 2-3 times in the morning to help the people of the state. Yes, we are a for-profit organization, but we are that key in the CPP. We very, very sincerely believe that unless and until the whole community health gets uplifted, there is no way we can do successful business over here. So with that, I'll close my. Thank you very much.